Hi everyone, my name is Nadia Aswan and I will be presenting with the other two members, Shafwani Atira and also Zohaira Ilana. So today I will be presenting a study titled Self-Reported Awareness of Genetic Testing, the Impact of Family History and Access to Clinical Trials for People Diagnosed with Ovarian Cancer in Australia. It is published in Gynecology Oncology Report. So this longitudinal study evaluates the understanding of genetic testing, knowledge gaps and clinical trial accessibility among ovarian cancer patients. So it highlights progress over 3 survey period, which is on 2015, 2018, 2022, and it emphasizes area requiring improvements such as awareness of germline and somatic testings. So first, we have ovarian cancer prevalence and genetic links. So ovarian cancer is a significant health concern with an estimated 1,850 new cases diagnosed in Australia in 2022. Around 25% of these cases are linked to hereditary genetic variant, so primarily mutation in BRCA1 and BRCA2 genes, so which are associated with an increased risk of both ovarian and breast cancer. Next, we have significance of genetic testing. So genetic testing is crucial for guiding treatment strategies, predicting patient outcomes, and assessing hereditary risk for family members. It is also plays a role in determining the eligibility of gene target therapies like PRP inhibitors. In the next one, we have knowledge gaps and challenges. Despite its importance, many patients lack awareness of genetic testing type, which is germline versus somatic, and targeted treatments. Accessibility to the genetic testing and also clinical trial varies, especially between metropolitan and non-metropolitan areas. Next, we have policy and practice changes, which is in Australia has made progress in improving the access to genetic testing and treatments through updates in Medicare and pharmaceutical benefit schedules. Yet, significant disparities and knowledge gaps still remains. As means tumor-specific mutations that develop during the person's life will often guiding the use of target therapies such as PRP inhibitors for personalized treatment. Next one, we have germline testing identifies inherited genetic variants such as BRCA1 and BRCA2 mutation, which can inform not only treatment but also family risk assessment and preventive strategies. So basically, this study underscores that family history should not solely determine eligibility for genetic testing, as it may miss up to 44% of carriers without a known family history. Offering universal genetic testing ensures no patient is excluded based on incomplete histories, improving equity in care. So understanding of genetic variants also very crucial because it has transformed ovarian cancer treatment. For instance, patients with BRCA mutations often shows better responses to platinum-based chemotherapy and PRP inhibitors, so directly influencing the treatment choices and also the outcome. And beyond treatment, testing also inform risk reduction strategies for relatives that will enhance the opportunities for early detections and also preventions. The study highlights significant knowledge gaps among patients, with many unaware of somatic and germline testing differences or the availability of gene-targeted therapies. So increasing awareness through patient education and clinician communication is very essential. The first, promote early diagnosis, which is crucial for improved survival rates, and second one, to encourage broader participation in clinical trials, especially in underrepresented rural areas, to expand the access to cutting-edge treatments.
For the method, the participants are the individuals that have been diagnosed with ovarian cancer or those who are affected by it, such as their family or caregivers, and they are requited through Ovarian Cancer Australia via emails, website, and also social media platforms. For the survey design, it was conducted at 3 times, which are during 2015, 2018, and 2022, and each round of survey question was reviewed to ensure accuracy and appropriateness, and also each round was updated for currency while maintaining consistency of question, since there is the possibility to enable longitudinal comparison. For the data collection, the survey was open for 3 to 4 weeks with a reminder emails and new social media posts occurring after 2 weeks to encourage participation. The survey response will be collected anonymously to prevent tracking of individuals across the 3 surveys that was conducted during 2015, 2018, and 2022. For the data analysis, descriptive statistics were used to analyze survey response, including frequency of response type and percentage of total response categorized by age range and location, and the change in response percentage through the survey cohorts were also analyzed to monitor the trends over time.
Here I'm going to talk about the result from the finding. As you can see, the box is about the awareness of link between family history and risk for ovarian cancer. Comparison of survey response proportion from 2015, 2018, and 2022. In 2022, about 62.9% were aware of the link between family history and the risk of developing breast or ovarian cancer before their diagnosis. This marked a significant increase compared to 2018, when only about 50% were aware, and 2015, where awareness was just 44%. This upward trend highlights growing awareness has improved over the time. Okay, next, the second table shows the number and percentage survey respondent aware of the link between family history and risk for ovarian cancer by age group. We can say that younger respondents were generally more aware, but all age group 40 years and older showed increased awareness in 2022 compared to 2015. Let's take a look at how self-reported genetic testing data have changed over time in three survey cohorts: 2002, 2015, and 2018. Genetic testing is crucial for identifying hereditary cancer risk. In 2002, 69.5% of respondents, which is 198 individuals, underwent genetic testing. In 2015, the percentage of respondents undergoing genetic testing had decreased to 44.7%, which is 71 individuals. And by 2018, the percentage increased again to 67.7%, which is 285 individuals, similar to the level have seen in 2002. Now let's see the self-reported awareness of non-BRCA gene variants and linked to hereditary ovarian cancer. There were two questions were asked during the survey. The first one was awareness of genes other than BRCA1 and BRCA2 linked to hereditary ovarian cancer. And the result has collected only 27% of respondents, which is 68 out of 252 were aware of genes other than BRCA1 and BRCA2 linked to hereditary ovarian cancer in 2022. This shows a slight decrease compared to 2018, where 30.7% of respondents, which is 113 out of 368, reported awareness. The second question was awareness of link between non-BRCA variants and hereditary ovarian cancer. The result shows that 79% respondents who reported undergoing genetic testing for non-BRCA genes in 2022, which is 54.4%, indicated awareness of the link between non-BRCA variant and hereditary ovarian cancer. This data could not be compared to the 2018 survey due to difference in question structure. In this slide, I'm going to start with the comparison from the self-reported for awareness of somatic versus germline testing. In 2022, less than half of respondents, 45.1%, were aware of the difference between somatic and germline genetic testing. Among those who had undergone genetic testing, the awareness was slightly higher at 54.5%. This question was actually new in 2022, so we don't have any comparable data from the previous year. Move to self-reported for awareness of treatment targeting ovarian cancer by gene variant. For awareness of the treatment targeting ovarian cancer caused by specific gene variants, there's 43.8% of respondents were aware in 2022, which is consistent with 43.7% in 2018. However, this represents an increase from 30.6% in 2015. It is actually very important to note that earlier survey focused on BRCA mutation, whereas the 2022 question referred to gene variants more broadly. The last table shows self-reported awareness of participation in clinical trials in 2022, 2018, and 2015.
There are four implications, and the first one is the lack of understanding of genetic testing types, which are the germline and somatic, has remained unchanged since 2018, even when Australia has a high genetic testing uptake rate of 69.5% compared to the international average of 51.1%. Even among those who underwent the genetic testing for non-BRCA variants, only 54.4% were aware of the connection between these variants and hereditary ovarian cancer. The second one is that there are still significant knowledge gaps that persist in understanding genetic testing types and gene variant targeted therapies, despite the improvement of the awareness, because less than half, which is 45.1%, understand the difference of the genetic testing types, and only 43.8% are aware of the treatments targeting specific gene variants. The third one is the limited clinical trial options due to the limited understanding of genetic testing types and relevant for those without family history, and eventually impacts individual decision to undergo the genetic testing when diagnosed with ovarian cancer and potentially affecting the optimal care delivery. The last one is the overall participation rates in Australia are still below, which are 18.9% compared to the global rate of 23.7%, even when the clinical trials have improved in the non-metropolitan areas.
From the study, we can find the significant that highlight the important progress in ovarian cancer care. The first one was the awareness of genetic testing and familial risk has improved, empowering early detection and better prevention. The last is ensure equitable access to care and clinical trials that lead to improve the treatment and outcome for all patients. From the significant, we can understand the study has contributed some knowledge to everyone as people are becoming more aware of genetic testing and its importance for ovarian cancer. It also highlights the needs for better understanding of genetic testing type and treatments targeting gene mutation.
For the conclusion, despite the improvement of the awareness about the genetic testing among people diagnosed with ovarian cancer, there has still remained knowledge gaps in understanding of the genetic testing types, which are the germline and somatic, and gene variant targeted therapies. Therefore, further work to improve the clinical trial awareness and access is required.